I'm thrilled to be joined tonight by Dr. Ann Peters, an endocrinologist on Beyond Type 1's Leadership Council. She's here to answer a lot of the community questions we've been getting about COVID-19. Ann, did you want to quickly introduce yourself?
Yes, hi, I'm Ann Peters. I'm a clinical diabetologist at the University of Southern California, and I spend my life seeing patients and answering questions. So I've gotten many, so I'd love to help you with yours.
Excellent, thank you so much. And before we get started with the questions, I do just want to say this is a rapidly evolving situation. It's currently 7 p.m. Pacific time on Wednesday, March 18th. So things might change since we've recorded this. We'll try to update you guys as much as possible, but just keep that in mind when you're watching this. And I think the question we've been getting the most, and it's something that you and I have talked about a little bit, is people are really curious about risk factors when it comes to diabetes and catching the coronavirus. I think the question we get, number one, most of all, is, are people with type 1 diabetes more susceptible to catching it?
Well, so let me just give you the answer we have as of this second. And it's an answer that's been informed by a number of my colleagues around the country because we're all talking about this. And first of all, we have absolutely no idea. But I can tell you that I think that type 1 diabetes all by itself is unlikely to be a risk factor for catching it. And it's probably not a risk factor for having a worse course. On the other hand, we do know that poorly controlled blood sugars are an increased risk for all infections. And so there's no reason to think that this would be different. But again, we don't have cases with type 1 and this disease. The things that are the worst, and I hate to say this because I'm in a worse subset, are age, and you can't take that back. And then the presence of other conditions like heart disease, hypertension, so older people, sicker people need to be very careful not to get this. But younger people, healthy people, good control. Otherwise, like most of my patients, I don't believe that they're any higher risk, except that when you get sick with type 1 diabetes, as everyone knows, your glucose levels may be harder to manage. Sometimes people go into ketoacidosis if they don't get enough insulin and have enough fluids, so that, you need to not get sicker when you get an infection. And I want everybody to stay out of the emergency department. So my goal is to have everyone prepared with sick day rules, everyone ready to take care of anything that comes their way, and then they'll take care of it. So I feel positively like the people are going to do fine, but they just have to be sensible.
That's great. And so just a follow-up question, I think I might know the answer based on what you just said, but a lot of people are curious specifically about their children living with type 1 diabetes, because with the coronavirus, I think the literature out there now, the studies are saying that children are very unlikely to catch it. Is that the same for children with type 1 diabetes? Do we just not really know?
Well, we don't know, but it's not that children are unlikely to catch it. It is unlikely that children will show signs of infection. So children catch this all the time. And that's one of the problems, is they can be secret vectors of this. They can be asymptomatic, but children seem to get this oddly attenuated version. So it's actually why you have to be careful about children, because this is spread through, sneezing, coughing, and spit. And, if little kids are drooling, they could have it. But it's actually been great that kids aren't seeming to get this and get really sick from it, but they could carry it. But there should be no difference in kids with type 1. Again, we don't know. We don't have any experience with this, and we'll learn. But, my bet is they're just fine, just like everybody else.
Great. Can I ask, this question might be a little bit of a tangent, but we had some discussion in our Facebook comments about the meaning of immunocompromised or immunosuppressed. Are people living with type 1 diabetes immunocompromised, or is that even a scientific definition? What are your thoughts on that?
Well, my personal thoughts, which have nothing to do with science, is that makes me annoyed, because I don't think you all are immunosuppressed. I don't think type 1 diabetes makes you immunosuppressed, but it's historically, that's how people thought of it. Because if you think about the worst case scenario, and I see this because I work in East LA, which is a very poor part of town, people who have A1Cs of 12, 14%, their blood sugars are really high, and those people get a lot of infections. I mean, those are people where the vulnerability to infection is really high, but then we've we've extrapolated from that and say, oh, these people are immunocompromised. So yes, if your sugars are sky high, it probably makes you more susceptible to infection. But it's not immunocompromised like you're on a anti-rejection drug or getting chemotherapy, or it's not the same thing. So I would say that there's a glucose effect on the immune system, and higher glucose levels can make the immune system less robust. But I don't see that as a state of immunosuppression in a well-controlled patient with type 1 diabetes.
Excellent. Thank you. So I'm going to shift into questions about how we can best protect ourselves. I'm living in San Francisco, where we do have a shelter in place going on. So I've been kind of hunkering down at home, but not everybody is in a location like that. And some people with type 1 diabetes have taken the proactive step to just kind of stay at home and not leave the house. Is that wise? Are people safe to go to the grocery store? Or if you're living with diabetes and you have a job that you need to go to, what would you recommend to people living with diabetes? How much social interaction is appropriate, I guess, at this time?
Well, I would say probably just the same as everybody else. But let me just tell you, I'm a mother, and my son is 28, and I'm a mother to all my patients. And I say, for once, use diabetes as a way to get out of things if you don't want to do them. So I have patients where they could work at home and their boss, for whatever reason, isn't letting people. So I write a letter and say, this person has diabetes, they're at increased risk, let them work at home. So I kind of feel like I just don't want anybody to get it. So just if diabetes can help you get out of things for this one time in life, then do it. But I don't think people with type 1 diabetes need to live in fear. I think we're all living in fear, but I don't think you should live in extra fear. And I think that people need to go to the grocery store. People need to take walks outside. People need to socially distance. That's all fine, and people should do that. But, be sensible. So if you're going to the grocery store, keep space between yourself and people, and just do all the sensible stuff. And I think I think we can create a new normal, because this is going to last for a while. So I think we just all have to say, okay, how are we going to do this in a way that lets us live our lives? And, how can I have dinner with a friend? And, maybe it needs to be at home and you separate, you stay 6 feet apart, but that's fine. Use paper plates. There's all sorts of ways that all of us should be behaving. So like I said, I protect my patients with type 1 diabetes because, I have to mother everybody. But, my son is living in New York City. He's doing his thing. He doesn't have diabetes, but he's my son. I want him to do the right things. And he's living the life the way I think that all people with diabetes or all people should be doing it. So I don't get crazy about it. But again, it's a good excuse if you need one.
Yeah, absolutely. And we got a lot of questions similarly about people who might be staying home with type 1 diabetes, but they're living with someone who isn't, and who might even be at a job that they consider to be higher risk of getting infected, like a grocery worker, or I think one woman worked at a hospital and her husband had type 1. Are there any extra precautions you should be taking if you're living with somebody who is out in the public a lot and you are staying home?
Well, so let me just tell you, the person with whom I live is 75 years old, and he has diabetes, and I can't infect, right? I can't get him sick. And it's not because of the diabetes, it's because he's 75 years old. So I am just insanely careful. And we're lucky enough that we have our own bathrooms. So bathrooms are a point of spread. So if you can have separate bathrooms, then you don't want to share towels. You want to keep everything separate. And I actually now go to work in a set of scrubs. When I go to work, I just leave the house in the scrubs. I come back. Before I do anything, I take off the scrubs, throw them in the washing machine, run upstairs and take a shower. So I decontaminate myself. And as soon as I've done that, then you can be in the same house just fine. So I just say, let's not contaminate each other. And you can do that because I'm in a high risk position because I'm seeing patients all day. So just be mindful of that for all of us. But you can live there, but it's the bathroom thing. So if you share a bathroom, decontaminate, going in and going out, because that's what you want to do.
Great. And I think just along those lines, what about, well, this is a kind of a different question, actually. I think people are concerned rightfully about overwhelming the healthcare system. If somebody had, say, a routine checkup with their endocrinologist, would it be wise to reschedule at this point? Or what's the recommendation there for, I guess, kind of routine maintenance not related to the current outbreak?
So this is my concern, is that people with chronic diseases in China kind of got left behind. And my feeling is that I'm a social person, and connecting with my patients makes me feel like I'm giving them something. And if it's advice about how to live with this, pandemic, if it's advice about adjusting their blood sugars, I want to keep doing that, but I can do it through telemedicine. So most of us now have switched to telemedicine. And so it's a little bit harder because I particularly have older patients who aren't used to uploading their devices to the cloud. So we actually spend a lot of time helping people do that. But I can do a perfectly normal visit on telemedicine. So I would say not to forego a routine visit, but rather to try to transfer it to telemedicine. And if there's an urgent visit for whatever reason that you need to go in, then you need to do that. But I think that this approach of telemedicine is really a good one. And like I said, I want people to know we're there for them. I have never been busier with emails and calls and people really upset, and I understand that. But I also think keeping routine contact is a good thing. This is, as I said, going to last a while. So, I can look at data and I can look at the GMI and figure out an A1C, and I can make dosage. I can do all sorts of things just with technology. So I think staying in contact is a good thing. But the corollary to that is we endocrinologists are as fallible as anybody else. So if your endocrinologist gets sick or is too busy doing other things, then people are going to have to rely on their primary care doctor. And if not that, the very least, they need to have backup supplies and everything else. So everybody needs to be able to function even if their endocrinologist isn't immediately available. So we all have to take care of each other, but also ourselves.
Excellent. And you just said that people all need to have backup supplies. I actually didn't have this written down, but I think it's an important question to ask. What are you recommending in terms of people refilling their prescriptions? I think people want to be stocked up, but they're wary that they don't want to be seen as kind of hoarding or overwhelming the market and, maybe taking up too much time if they don't really need the prescriptions yet.
Well, so what I've been told many things. It's very hard to actually know what's really going on, but that a number of insurance companies are making it so you can stock up on things. But the insulin companies the major insulin companies have all reassured the American Diabetes Association, the JDRF, and therefore me, that we're not going to run out of insulin, so that insulin will be available. Alcohol pads, on the other hand, may be hard to come by, but insulin will be available. And I think it's really good to try to get 3 months supplies. And if your insurance company gives you an extra month, get anything you can. I think it's really good to get insulin delivered in 3 months supplies so that you don't have to go to a pharmacy. And I do know that at least in Los Angeles, there are pharmacies that deliver. So anything you can do to not have to go to a pharmacy, because that seems to me a bad place to hang out, is good. So I would make sure prescriptions are for 3 months and transferred to a mail order kind of thing. But the harder thing is devices, because for me, the paperwork to get you your devices is so overwhelming that we may not be able to do it, because every device requires 3 different forms and they lose the forms, and they're just, at baseline, all of us are insane about getting you all devices. So everyone's going to have to know how to give injections if they're on a pump, and everyone's going to have to know how to revert back to finger sticks. I mean, the thing that we may be least able to get is devices. So, my answer to this would be that every device company lets you call them on the phone, say, I've been on a pump or a sensor for the past year, just send me refills. Don't ask my doctor, just send it to me. I think, I honestly think that we haven't cured diabetes in the past 6 months, and that they should actually appreciate that you need these devices. But that's, to me, the hardest part as a physician. And if I'm so busy taking care of patients, and if my patients get sick and I have to go and, work at the screening booths or whatever I have to do as a physician, I'm not going to be sitting there being able to fill out those forms. So I wish somehow we could reduce the paperwork right now to get you all devices. That's my bigger worry. So, but everybody needs to have test strips at home. Everybody needs to be ready in case they can't get their devices.
Yeah, that's great advice. And it would be amazing if we could get those devices without the reauthorizations. I go through that 2 or 3 times a year. I mean, I'm sure you go through it many more times than that with all your patients. So I think that's a great idea. I just have a few more questions I wanted to ask. There was a recent publication, I think maybe a week or so ago in the Lancet, that suggested maybe some correlation between ACE inhibitors and worse outcomes for people with coronavirus. I just wanted to see if you could weigh in on maybe your thoughts on that and what advice you would give to people with diabetes who are taking ACE inhibitors or that type of medication.
Yes. So I've asked the experts about this, and I've gotten a resounding, well, I won't exactly say what they said here, but I can tell you that the people I respect in the field don't believe that that's true in terms of that we don't have enough data to really support that. We don't know what that means, but we do know that ACE inhibitors and ARBs are incredibly beneficial at helping people when they're sick, especially if they have hypertension and cardiovascular disease. And the American College of Physicians, the American Heart Association, everybody's come out and said, that's crap, don't believe it, don't listen to it, don't change your treatment. And if we figure out that that's not crap, we'll tell you. But at the moment, we truly believe that the mortality benefits, that the overall benefits of those agents far outweigh any potential risk, and that study was a one-off, and who knows what that study means. But at the moment, we can't really stop anything because we know that the benefits seem to be so much greater than a risk. Again, try not to get sick. Like, well, all right, but stay on those drugs. And unless we find different, but maybe next week I'll tell you I found out something else. But the analysis of that data has been that it's not solid enough or broad enough to change any recommendation.
Is that similar to, I think I saw another report maybe a couple weeks ago about NSAIDs, such as ibuprofen, and seeing a higher rate of coronavirus with people who are taking NSAIDs. Have you seen that?
Yeah, I saw that too. It somehow seems mostly in France. But
Yeah.
honestly, we all don't believe that either. So much stuff comes out. It's one paper or one person's opinion. I review all the literature every night that's published in this area. And a lot of it's just one-off, and because if you put COVID in the title, it seems to me to get published. So, we just don't know. It takes years to get scientific data that really is true. We study things over time, and all of a sudden we've had something for 4 months and all this stuff's coming out. And what does any of it mean? Is it really something clinically relevant, or is it just something in a lab? Is it only true in Wuhan? Is it true here? I don't know. So that's why I'm being so careful at trying to figure out what we know and what we don't know, and not overreacting. Any one thing is just one thing. And science is always, you have to prove it 4 different ways to make it real. So just peace when it comes to new things that come out.
Excellent. So obviously the best thing for all of us living with diabetes to do would be to not get sick. But if we are feeling sick, I'm wondering at what point should someone with diabetes reach out for help, and maybe how should they go about that? Like, what symptoms should trigger somebody to reach out to their medical team?
Well, COVID-19 is a fever, first and foremost, and then a bad cough. It's not a headache, it's not a runny nose, it's not a sore throat, it's not even muscle aches. It's a fever. So everybody should have a thermometer at home. And frankly, I've taking my temperature every night because, again, I'm at more risk because I'm a healthcare provider and I want to make sure I'm not getting a fever. Even if in LA County you're getting a fever and have a cough, we don't want you to do anything but stay at home. And it's very likely that that fever and cough in somebody who's below the age of 50 is going to just resolve, and you'll feel achy and icky and you'll drink fluids, and that's fine. But if you get short of breath, that's when you want to go and get tested for COVID-19 and may end up in the hospital. But even in our medical system at our USC, what we found is we have a pretty stringent rule for who gets tested for COVID-19 because we don't want to waste the test kits. And thus far, even clinically, when I see a patient and I say, oh my gosh, that's got to be COVID-19, they're febrile, they're coughing, they look like crap, only 25% of those people test positive. 75% of the people that I personally think have COVID-19 are negative. And I personally means the institution. So, we actually are seeing all sorts of other viruses and sicknesses that most people would have ignored. And now we all think it's some horrible thing. So I think for most people, and particularly a younger age group, we're just going to have this be like a head cold, and they're going to be fine. And they don't need to clog the emergency departments, and they don't need tests. But for someone with type 1 diabetes, if their blood glucose levels start to be too high or too low, if they see a lot of insulin resistance because they're sick, particularly if they're vomiting, any of that would require, a contact with their endocrine team or whoever their diabetes management team is. And then if really sick, to go to the hospital. But this is one of those times when you want to self-manage at home. So if your glucoses are low and you're sick, if you can consume carbohydrate-containing fluids and give insulin and keep yourself out of ketosis, that's what I want to see. So, we want to keep everybody out of the hospitals because that's not a good place to be. So I think everyone needs to have fluids on hand, low-carb fluids, high-carb fluids, insulin to inject, everything so that I can help people through if they get sick. But the GI side effects are much less common with COVID-19 than other things. So it's not common to get nauseated and, stick to your stomach. But if you get insulin resistant and get ketotic, that can cause you to feel sick.
Awesome. Well, I think I covered all the questions that I had, most of the questions we had from the community. Is there anything else you would want to tell the people out there living with diabetes who might be worried about this, or just anything else that you think we should know?
Well, I think it's normal to be worried and it's normal to be upset because all of our lives have changed so much. But I think that the type 1 diabetes community is a wonderful group because it's so interconnected. And I think that everybody just needs to connect with each other. And there's a lot of time and space now for connecting, this way or however people want to connect. And I think it's really a good time to support each other, but don't fall prey to misinformation because, we just hear so many things, and it's the basics of type 1 diabetes are you all know how to live with it, you know how to deal with it, and that's not going to change. And we're still here. So just day by day, step by step, don't catastrophize and just do the best you can under these circumstances. We'll create a new normal. This will get hopefully better, but I think it's going to get worse first because we're suddenly testing all these people. So it'll get worse for a while and then it will get better. And then who knows? I can't predict. But I do believe that at some point we'll have a vaccine. I believe at some point we'll have treatments. And young people are at much less risk than older people. So I think it's awful on some level, but it's also quite survivable on another. So just don't panic. And I'm working with other sources, and I think, we could do this kind of thing every 2 weeks if you want. Anything that helps people get information that would help them feel better and ask your questions. So that's a really good thing. So I really appreciate you doing this actually, because I think that people need to know. I think fundamentally people are going to be okay. So, that's just my message.
That's great. Thank you so much. I'm sure we would love to do this again. And I know you've been helping us a lot with the written content too. So we definitely appreciate it. We want to make sure everything is factual and we get all the important information out there. So thanks so much.
All right. Thank you. Be safe. Take care.